Hi, I'm Dr. Tom Denisowitz with Airrosti, and we're going to talk about neck pain. Now, all the information that we're about to go over comes from our live free webinar series, where we go over a new injury every month, and for more information about that, click the link below. Without further ado, let's get started. Let's talk about some misconceptions of neck pain that we often hear from patients as they walk into our office. The first thing that we hear is that they've been told or heard they have a bone out of place. And the reality is the neck bones have a certain range of motion associated with them. And what often happens is that range of motion gets stuck or fixated. And that's that fixation that can lead to some pain. But the bone's not really out of place, it's just not moving the way it's supposed to. We often hear that patients will come in with arthritis and think that that's automatically going to be the source of their pain. But arthritis is a spectrum from mild to severe, and it comes with different types of pain and different treatment options. We also hear that patients who have sharp pain or pain that radiates always think they have a pinched nerve. Oh, doc, I woke up and I've got a pinched nerve. But pinched nerves can sometimes be the cause of pain that's sharp or radiates to a different spot, but there are plenty of different sources of the neck that will radiate pain or create a sharp sensation. And if we're going to talk about neck pain, we have to talk about headaches. And often patients come in and assume that if they have a severe headache, it has to be a migraine. But that's not how a migraine is diagnosed. And instead, it's due to what the source of the headache is. And many sources of the headaches can be coming from the neck, and they can still be very severe. Let's talk about traditional neck pain, or kind of like waking up with that crick in the neck. Now, there's a lot of tissues in the neck that can become pain generators. Your muscles, the joints that allow movement, the ligaments that help support it, and even the discs in the neck can all get irritated. And a lot of times that can happen due to a trauma, right? If we get our head whipped in a motor vehicle accident or in a sporting field, it's going to stretch those tissues and make them painful. But we can also see that happen just in gradual day-to-day activities, like when we hold ourselves in poor posture. It can start to stretch those tissues to the point where they're painful. Now, the other thing to understand is even these tissues, the muscles, the joints, the discs, when they become painful, they don't always just stay in the neck as well. If you've ever had that neck pain that almost feels like it's radiating into your shoulder, that's very common in these conditions as well. Did you know that a lot of headaches can actually be coming from problems happening in the neck? Let's talk about that a little bit more. How does this happen? Well, usually it's due to some posture or static held positions that put stress and strain into some of the muscles and joints in the neck. Now, when these muscles or joints get irritated, they refer to very predictable patterns that are usually associated with certain types of headaches. So if you have irritations to the joints or muscles in the back of the upper part of the neck, we often are going to see that lead to a tension type headache that almost feels like a band or a vice grip around the head, almost like a headband. If you get irritation to some of the muscles into the front of the neck, into the muscles that help hold our head up, then a lot of times we're going to see that refer almost like a sinus type headache. It'll start to create pain right at that point in the head, right by the eye, that you a lot of times will associate with a sinus type sensation. And we can also see some irritation happening to the nerves that will cause headaches. So the occipital nerves, which again sit in the upper part of the neck, if they're irritated due to poor posture, due to increased stress, are going to radiate and create pain all along the whole side of the head, like that typical really bad headache that sometimes we see. How do you know if you have a pinched nerve in the neck? Well, a pinched nerve in the neck is fairly common, and it can be a major source to neck pain and pain that radiates down the upper arm all the way into the hand. Now, what happens there is usually a disc is starting to move backwards out of its normal alignment and starting to put pressure onto a nerve. That pressure is going to irritate that nerve, and it's going to travel down the full length of that nerve. Depending on what nerve it is, it's going to show a different pattern. Nerves in the mid part of the neck are going to go more into the upper arm. Irritation to nerves in the lower part of the neck are going to go down into the hand. But the problem can be, a lot of times tissues that are in the neck or close to the neck will have a very similar pattern. In fact, the scalene muscles that sit from the neck and attach to the ribs, when they have pain or irritation, will have almost an identical pattern to some of these nerve irritations. So it becomes really important to have this assessed by a professional that knows the difference between nerve pain and referral pain from muscle or joint sources. We hope this video has been helpful. All the information has come from our live free webinar series where we go over a new injury every month, give you some simple exercises to try at home, and finish with a live question and answer feature where you get to ask your questions to one of our providers. For more information about that webinar, please visit airrosti.com/webinars. Thank you very much. We'll see you next time.